myself, I'm Dr. Shivani Sood, co-founder Shivani Ayurveda Poland, founder Shivani Ayurveda and co-founder Shivani Clinic. And from last 21 years, I'm in the field of Ayurveda. अभी हिंदी में लेक्चर देना भी थोड़ा डिफिकल्ट है, तो if anybody has any question, then let me know.
Okay.
ठीक है, because I want that this lecture is clear for everybody. Because in this lecture I'm trying to kind of show how Ayush can integrate into Europe and give a good future for all the people in Ayush, which is something which I really like, getting people together and working towards common objective. So my resume is here. I've done 42 international projects. They have been done in Europe. A project means in which we organize consultations and there is workshops on different topics which is directed towards European society issues, whatever we are having. And I have an active clinic in India, founded with my husband, Dr. Ayush Kumar. And I'm the honorary member of the Polish Association of Ayurveda, in which more than 100 people are there, out of which around 60-70 are associated with me. And we are helping make Poland a better place with principles of Ayurveda. Obviously, Ayush is a part of Ayurveda and there is much more Ayush can offer to Europe also. And the thing is about realizing the responsibility we are having about spreading our science and representing our science in a proper way and being proud of what we do. So I've been featured on major US channels where my work has been published of introducing Ayurveda to the modern society issues. So, you know, Ayurveda is in 5000 BC science and today the world, especially in Europe, stands on a very different platform. It's different topics which are coming in the society and somewhere an adaptation is definitely required which will help us understand them and use Ayurveda, actually without using the word Ayurveda, helping them resolve the topics they are facing. The backsmith. So this is about Shivani Ayurveda Poland. That's 3 years old company. Me and my husband both are doing the work in Shivani Ayurveda Poland. We are the founders there, co-founders there. It's emerging as one of the biggest school in Europe for even education. Education doesn't mean we train doctors. We reform the society with our different programs. So it's also a health center in Poland. So there's therapists there. It's an active clinic. And we just established the clinical part here in Poland after the pandemic as the society is setting back. The focus area is basically on the major issues there. The issues somewhere in India we don't hear, like problems like emotional eating. Emotional eating is like bulimia, anorexia, all these issues. Females have a lot of issues with also body image disorder. There is this thing about being the perfect female there. It's a very highly competitive world for the female, puts a lot of pressure on females. And we are helping the females there with these issues of psychological transformation, which is open for all. You really improve your life. In Dinacharya, always in Ayurveda practice, we have this that we're using the time of the doshas. For example, if you're confused, then the best time to take decision is early in the morning. Why? Because it's a kapha period. So in the kapha period, our mind is more stable. So never, and most of us, what we do, we start to think about issues while sleeping. It disturbs our sleep, and so these are the fragmented way where we are using Ayurveda in the simple style, which can improve the life in the European society. And then, of course, there's a lot of issues with work-life balance. I have done recently a workshop in April in Poland, where highly successful businesswomen and people who were entrepreneurs, they came in and they learned how to balance work and life. Because apparently this is happening in India also, that we forget that the reason why we are being successful is for our family. We need to not only be a good person in career, we need to be a good mother. A guy should try to be a good father. We should try to be good children to our parents and never forget our cultural values, which we can teach to Europe, the integrity of family and all these things. So This is a big topic there, how to manage stress, because the pace of life is like this. It just goes very, very fast. You have to do all the household work. In India, we are blessed with having help in our house, but there you have to do all the household work, cooking, your career, your children. So these are some of the focus areas Shivani and the Poland is focusing on. And behind also working with the psychological reform of identifying different dosha behaviors. For example, what can go wrong with the vata, anxiety issues, management of multitasking is difficult. For pitta, it is mostly like, thinking I am the only one, I don't want anybody else to shine, and trying to lead people, not trusting people. So these kinds of things we are working with a psychological reform in the Polish society. This work is not limited to Poland, because in 2006 I started my European projects, and with the European projects, first I tried to study how they are before trying to teach them some Ayurveda. Because most of the time we are us and we want people to learn, but when people are different than us, for example, if somebody tells to us like, oh yes, now you have to do some medicine from Africa, we will say why? We have our Ayurveda, why we should go to African medicine. So we'll have to understand the people of Africa first to kind of put Ayurveda for them. I would like to share a small clip from my co-founder Monica, who specially made the clip for our global summit, and she has a small message for all of us.
Of Ayurveda, yoga teacher and an Ayurvedic therapist. I learned Ayurveda in India, among others, from Dr. Shivani Sood. The creation of the Ayurveda school in Poland is the result of the growing interest of Poles as a whole in natural methods of treatment. For decades, they had become accustomed to chemical drugs. Only in recent years have they begun to turn to natural ways again. They began to notice that medicine treats only the effect, and without paying attention to the cause, problems will only recur. They have also begun to see the connection between mental health and physical health. For many years, Western medicine did not take this approach. Today, conventional medicine is reaching conclusions which Ayurveda reached a long time ago. We have more and more studies confirming the effectiveness of Ayurvedic techniques, which is increasing the confidence of Poles in this approach.
And then you can introduce some additional practice for your people, and it's not allowed by other people to practice. I mean, there are ways to practice around it, but you're not allowed in many countries. France is particularly very strict about this, because they are not aware of the benefits what can come. Where I was, which is Germany is my primary country where I started working with Ayurveda. So Germany, Austria, Netherlands, these three countries have a much better scope of practice of camp, less regulated. But what is regulated is the medicine system. For example, as a doctor in India, you can diagnose, but as a doctor in Europe, you can't diagnose. Diagnosis has to be done by house of physicians who diagnose what has happened to you. You cannot tell somebody a diagnosis, like you cannot say you have an ulcer, because this person can then go and say that this person said you have an ulcer, and you might have said it in a physiological state, and in like kind of pathological state, it's not yet visible, and then you will be in trouble. So you cannot diagnose, but you can treat, provided the people are aware of what you're doing to them. You're very much answerable to all of their questions, and most of the time they sign a form. They say that I have been informed about everything and I'm willingly doing this on my own risk and responsibility. The best country for practice in Europe is Switzerland. Switzerland is into also energy medicine, which is not part of Ayush, but it's also into Reiki and healing, chakras. They're highly crazy about this topic. And I think they're part of the culture comes from like nature, cows, cheese, milk, and they're very cultural people, and so they have accepted the practice of Ayush in a much better form. There's more structure. Ayurveda is recognized in Switzerland, but for the free choice of therapy means in the CAM countries, that means a person is free to choose. And in Switzerland, the CAM is integrated with the medicine system, which is something similar like we can integrate with the normal Western medicine and offer a wide range of choices for the right disease. Because as it's a proverb, if you need a needle, you can't use a sword. So you cannot, for whatever you need something, you need something. So when you integrate it with the rational system, then a person can have a widespread choice. And Switzerland offers this Ayurvedic thing as one of the main treatment which is understood. Also homeopathy, also naturopathy in its form. But as I said, Unani, Siddha and all, like till now, I am not aware of any like existence of these sciences there. So it still has its way to go to Europe. So now a short presentation on how Ayurveda came to Europe. Very interestingly, many people think that Ayurveda came in with Indians going to Europe, but that was not the case. While in 1990s, somewhere like that, 70s to 90s, lot of white people came to India seeking spiritual answers. Lot of white people. And we know that Osho is the king of that era. So when the white people came in, along with this, the gurus and the yogis started suggesting Ayurvedic things to them, which incorporated the use of turmeric, use of some herbs, triphala, ashwagandha for stress management and all this. Small parts went to Europe. And later Europeans started seeing that their quality of life is improving with the integration with Ayurveda. And so the European followers of Ayurveda started to promote Ayurveda and created a new category of working people there, which are called as holistic health advisors, or they are called as Ayurveda therapists. A therapist in India follows the direction of the doctor. Therapist in Europe has much more depth about this knowledge and knows his scope of work because of the medical system there, and is working with the people there. And I will tell you why they are needed also, because sometimes we think like, okay, we have to take it there, but there's whole lots of challenges in between India and Europe. Ayush practice. PERT means what is that, what is happening for us in Ayush, is the rising awareness. People are aware that conventional medicine is not the choice. People are educated there. They want to know more. They want to know why they have to follow this modality of chemical pills, which will never finish when there are other options they could look into. Another good thing is that the rising of the women awareness. Women are the center of the family. A good mother can raise a good family. Family is in the hand of women, and women have a lot of empowerment right now, coming greater rights in decision making in the family. Need for holistic support, definitely, because going back to the roots is a very important thing. When we go back to our roots, then we start to feel more balanced. So their fast-paced life asks for this. The medical system in Europe has very short visits, sometimes 5 to 10 minutes with the doctor, in which it's quickly prescribed and every patient gets 5-10 minutes. Whereas in any Ayush practice, I have seen all the doctors explaining properly to the patients what is the condition, what are your choices, what you should eat, what you should not eat, what you should do, everything, which is missing in the Western medicine there. Elderly population, there is a whole lot of elderly population. Their population is on downfall because there is less and less children. So geriatrics has a lot of scope there. Joint problems to pain management, it has a lot of scope there. Most of the time I see the geriatric patient visiting Thai massage parlors. They go for weekly massage or something and they're looking for deeper solutions to their pain and aches. And integration with science, which is the positive thing happening. Even there is like research papers published on how Shirodhara is connected with meditation. Like So when you get a Shirodhara, then how many minutes of parasympathetic activity is there? Because they have a lot of instruments. And I mean, Germans are famous for numbers and machines. So they are measuring everything, how much the stress rate improved, how the sleep quality improved. So they're bringing all these statistics into the alternative science with the Ayush practices. And that is really good because people understand. And the limitation is definitely the language barrier. Every Europe, I speak German, but every country in Europe has a different language, different culture. Unless like US, Canada has a lot of migrants, so you can speak in English, it's fine, but there you have to learn the language. Because we all know as doctors that you need to know how to talk to your patient. This is the most important thing, the trust which happens in between a doctor and a patient. So language is definitely the barrier. Cultural difference, it's completely culturally different. For example, how we invite people to eat, how we behave with them, and these all things, when you learn their culture, then they accept your medicine more. And then regulations and recognition. So in our Polish group, we are trying to get this profession recognition in Ayurveda. And there is also, I know in Germany, there are some of my friends, they are working on recognition of Ayush in cancer. Because Ayush has a lot to offer to cancer patients. Post-treatment also, all the things, and they are doing this thing with the government to kind of integrate it. And as I said, the education is there, so they are seeing that there is more difference than chemical medicines. But the limitation is also there because the medicine availability, leaving homeopathy, Ayurvedic people have very less medicine and regulations controlling the scope of the treatment. It is a modified version of what we can offer to the patients there. And the recognition of Ayush, like, mostly like I am in Europe, I am with Ayurveda people, all people around me. I think everybody knows Ayurveda because I live inside my bubble. But it's not like that. People don't know even what is Ayurveda. So basically Ayurveda is not, homeopathy is higher in practice than in European countries than Ayurveda. Ayurveda is around 4th or 5th position right now in Europe. And it's like yoga went over. Like 5-10 years before we heard yoga, now Ayurveda is on the rise in people. And homeopathic practice is mostly, this is related to just learning about the regulations of the country and working with the difference of this and getting your degree recognized from this medicine school. Right?